Hello everyone. Today we will discuss about hyperosmolar hyperglycemic state. It's an another complication, metabolic complication of diabetes, apart from the diabetic ketoacidosis. Let's see what is the definition of HHS. So, hyperosmolar hyperglycemic state is defined as a serious acute metabolic complication of diabetes apart from the diabetic ketoacidosis. And this HHS, hyperosmolar hyperglycemic state, it is different from decay in three aspects: in its severity, presence of ketosis, and presence of metabolic acidosis like condition. Just like diabetic ketoacidosis, HHS. Apart from that, this higher motility is also seen in some other conditions, like when there is already severe dehydration is present, as this HHS also cause some kind of dehydration when a person is of old age, and as we have already discussed, if some other comorbidities are present in the person. Let's see what is the pathophysiology of HHS, how this HHS like condition is developed. So, as we have already studied that there is some kind of insulin deficiency in the body, and this insulin deficiency leads to decreased glucose utilization by the muscles, and as the glucose is not getting utilized in the muscles, so this will increase the level of glucose in the blood, and this will lead to hyperglycemia like condition. And this hyperglycemia will lead to hyperosmolarity. This will increase the osmolarity of the blood, and this will cause the cellular dehydration because the water is getting secreted out of the cell, and this will lead to coma like condition, and ultimately death can cause. In another manner, in liver there is increased gluconeogenesis, means formation of glucose from other substances like fat, amino acid, etc. So this will again lead to hyperglycemia like condition, and as the level of glucose is increasing in the blood and serum, so this extra glucose will secrete in the urine. This condition is known as glycosuria, and as the glucose is getting out of the body through urine, so water will also get out along with the glucose, and this will lead to shock like condition, that is hypovolumic shock, and this will lead to pre-renal azotemia, and ultimately this will also lead to death. So why this ketosis like condition is absent in HHS, which is usually present in diabetic ketoacidosis? So there are few mechanisms for not having this ketosis like condition in HHS. So first one is, as we have already studied that in HHS there is no complete absence of insulin. So insulin is always present in some quantity in HHS. However, in DKA the insulin is either totally absent or available in very less amount, which is negligible. So ultimately this will lead to utilization of some kind of glucose, and there will be a prohibition of destruction of the lipids. In second mechanism, that we know that this ketone bodies or ketosis like condition arises when there is lipolysis like condition is there, means there is increased destruction of the fats and adipose tissue, and as in HHS there is hyperosmolar state, means there is increase in glucose level, so there is no need to get this destruction of the fats or adipose tissue, and this will not cause the lipolysis, and this will not lead to the ketosis. Let's see what are the conditions which cause HHS, generation of HHS. First one is acute infections like pneumonia and some other acute infection, UTI, urinary tract infection, stroke, myocardial infarction. This HHS can also develop when there is some trauma, and also in poor kidney function. Apart from that, there are some other factors which may also lead to generation of HHS. Those are, if any person is already having any neurological disorders, if person is in severe dehydration like condition, person is taking very less amount of water, and also some other debilitation like conditions, these all lead to HHS. Apart from that, there are some medications which also can cause the HHS, and these medications are glucocorticoids, phenytoin, thiazides, beta blockers, and some antipsychotics. Let's see what are the signs and symptoms which a person can show if he is developing HHS. So person can have headache and dizziness like condition. There may be some vision problems in such patients. Chest pain may also be there, as we have already studied that this HHS is hyperosmolar or hyperglycemic like state, which leads to dehydration. So these are the signs and symptoms which are associated with the dehydration like condition. Due to severe dehydration, patient can have weakness. There will be delay in capillary refilling. Polydipsia will be present. Increased thirst will be present, and patient will consume more amount of water frequently. Because of this dehydration like condition, skin will dry and mucosa will also be dry, and leg cramps can also be present. These signs and symptoms of HHS can also be divided according to the system involved. Like in CNS, central nervous system, patient can have drowsiness, delirium, he may feel lethargic, confusion can be there, he may develop seizures, and he can proceed into condition of coma. When cardiovascular system is involved, so we can find weak thread pulse, tachycardia, orthostatic hypotension. There may be delay in capillary refilling. In respiratory systems, person can have tachycardia, there will be increase in pulse rate, and chest pain can be there. Person which goes on HHS like condition can have some neurological symptoms, as these are also present in diabetic ketoacidosis. So person can develop seizures, there may be altered mental status of the person, and person can go on coma like condition. So let's see what are the complications which can develop in a patient of HHS. So most common complications which can develop in a condition of HHS, so it is hypokalemia. There will be a decrease in concentration of potassium in the body, and person can go on hypoglycemia like condition as well. Glucose level can go below 40 milligram per deciliter. Apart from this most common complications, there are some other complications which can also develop, like myocardial infarction, stroke, venous thromboembolism, patient can develop seizures, cerebral edema, and also there is possibility to develop aspiration pneumonia. So what are the methods by which we can diagnose this condition of HHS? So we need to take the medical history of the person. If there is any alteration in the requirement of the insulin of the person, we can have some laboratory diagnosis, lab investigations can be done. If there is change in dietary pattern of the person, if there are need of change of dosage of hypoglycemic medications the person is taking, if dehydration like condition is seen in the patient, and apart from that, if some neurological signs are seen on the patient which we have already discussed, so by this method we can diagnose the HHS. So let's see what are the lab investigation methods by which we can confirm the diagnosis of HHS. So we need to assess the blood glucose level, blood urea nitrogen need to be assessed, serum creatinine, serum ketones to differentiate it from diabetic ketoacidosis like condition. Serum electrolytes are also required to be assessed, as hypokalemia like condition is seen in this HHS, and there is high anion gap. Osmolarity need to be assessed at as this HHS is hyperosmolar like condition. Urine analysis needed to be done. Urine ketones by depistic method to be done. Arterial blood gas analysis to be carried out, and apart from that, complete blood count should also be done. So let's see how we can manage a condition of HHS in a patient. So as we have already seen that there is severe dehydration like condition is present in HHS, so we need to correct this dehydration like condition. Apart from that, we need to correct the serum glucose level, which is contributing factor for development of HHS, and ultimately we need to rectify this plasma glucose condition, as we have seen that in HHS there is hyperglycemic like condition, so we need to decrease this glucose level in the body, and apart from that we need to restore the electrolyte balance from this patient. Let's see how this treatment aspect will be applied. So for fluid resuscitation, as per this American Diabetic Association guidelines, for that we need to infuse the person with 0.9% saline, and the rate of infusion will be 15 to 20 milliliter per kg per hour. And we need to very careful, if person is having any cardiac or renal disease, the rate of perfusion will be slow. Let's see about the electrolyte replacement. As we have seen that in HHS, hypokalemia like condition is developing, so we need to provide the IV fluid, which includes 20 to 40 milliequivalent per liter of potassium chloride. And we need to very careful that potassium replenishment should be done before the insulin perfusion, when there is level of potassium is very low, that is less than 3.5 milliequivalent per liter, and this level of potassium should be monitored every 4 hourly. In insulin therapy, firstly, as we have already discussed, that we need to exclude the hyperkalemia like condition, and if it is excluded, then we need to give IV bolus of 0.1 unit per kg per hour of insulin. And if serum blood glucose level comes to 300 milligram per deciliter, then we can reduce this insulin bolus from 0.1 to 0.5 to 1 unit per hour, and we need to add the dextrose as well in that IV fluid. So let's see the follow-up in HHS. So in HHS, patient need to be followed up by the team of multidisciplinary specialist, and this team consists of physician, endocrinologist and pulmonologist, as we need to monitor the level of electrolytes, metabolic and neurological parameters by this concerned specialist. We have reached to the end of this video, and thanks for watching this video. Please like and share this video with others as well.